Hi guys, welcome back to my channel. My name is Imani. So today is part 2 of the series that I started on my last video when we're basically just talking about what life is like as a veterinary technician. So to start off, general practice and emergency are very different when it comes to a small animal clinic. For general practice, you generally know what your day looks like. You have everything scheduled out. But for emergencies, it's completely walk-in basis. So now let's kind of get into what kind of techs work at veterinary emergency clinics. So I guess it truly depends on how big your staff is, but normally it's divided into 3, at least for my 24-hour vet hospital that I worked at. So you have room techs that go in and actually speak to the owners and get all the information for the veterinarians. And then you have triage technicians that look like physically actually look at every single patient that walks in, and then that technician decides what is an emergency or what isn't an emergency. Just because if things walk in and you kind of go on like first come first serve, you might not be able to serve the ones that are really sick as quickly as you should. And then the third type of technician would be a hospital technician, or hospitalized, especially again at the clinic that I worked at. It was 24 hours. We had a bunch of hospitalized cases. So these people would monitor the hospitalized patients and also administer any medication. And then they would also help with anything that the other techs needed. So that's help with x-rays, help with ultrasound, help with blood draws and sampling. So let's kind of reverse a little bit on the triage technicians that I was talking about earlier. So for those triage technicians, they determine what comes straight to the back, what is an emergency or what isn't an emergency. So an emergency would be things like a hit by a car, gunshots, wounds, seizures, any type of like really crazy open lacerations, any overheating, anything like that. And then things that are not an emergency but obviously can still be seen at the clinic would be like a ear infection or a skin rash or a cough specifically. They might need to be separated. They might not be able to wait in the waiting room just because you don't want, whatever respiratory issues that patient has to get to the other patient. So they might have to go in a separate room, but that's kind of like a separate thing, but still that's not an emergency. We have to do this right now. So all my years as a veterinary technician, I have seen a lot of crazy things, especially in emergency medicine. I won't show the pictures because I believe they're a little bit too gory for YouTube. But I have seen hit by cars and just a lot of broken bones, a lot of broken pelvises. I've seen people take little smush face dogs like boxers or Frenchies or bulldogs out on a walk, and then they overheat and now they're just like kind of spilling out all their insides. I once had a dog come in that was trying to hop over like a log, like they were on a trail, and it didn't quite clear the log, so one of the branches like stuck it in its abdomen, and the dog, like it was a smallish dog, but the woman brought her dog in and the stick was still impaled in the abdomen, so we had to get that out and stop the bleeding. I've seen a dog come in because its owner, who was like a larger man, was sat down on his reclining chair and did not see his wiry terrier underneath him, and actually sat on him and squished his head so hard that his eyeball popped out. Not completely, but it was definitely out of the socket, could not save it. It was way too dry. They had to remove it. So yeah, you see a lot of crazy things. So hospital techs are also the ones that go into the surgery suite with the doctors when they have to do emergency surgeries. So this could be anything from a pyometra, which is basically the uterus of a dog just filled with pus because there is just an infection, and then you have to remove the uterus as well as all the pus inside of it. Another common emergency surgeries would be a splenectomy. So the spleen can contract a lot of cancerous cells and just have a lot of things wrong with it that can make it expand larger and larger than its normal size, and it has to be taken out. A lot of foreign body surgery, so that's basically when your little doodle eats, I don't know, let's just say a tennis ball and just chews it up and swallows the whole thing, and now it can't pass. So a lot of the surgeries would be the doctor going in and fishing out the tennis ball and then taking it out and then sewing the intestines back up. Also, dystocia is pretty common. That's when a pregnant dog cannot push all of her children out. So she basically needs an equivalent to like a C-section. But yeah, there are a lot of surgeries that happen in emergency medicine. Those are just kind of the recaps or the most common ones that I can think of. I personally love emergency medicine way more than I love general practice. It is really high pace. It is really just like go, 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 go. Things do die. Unfortunately, you can't save all of them. There are some really crazy like hoarding cases that come in sometimes too, but it is interesting, honestly. Emergency medicine is extremely interesting because you don't know what kind of day you will have. And for some people, they like that. They like the excitement. Other people, they want a little bit more structure. Structure-y people, maybe general practice is more your thing. The people that are like, let's get on the wild side. Let's see what the day brings. I would say emergency medicine is more your thing. But anyway, that is the life as a veterinary technician in emergency. It's crazy. It's a lot, but it's worth it. But in general, veterinary medicine is worth it. So anyway, I hope this helps you guys out if you're thinking about becoming a technician and like you're trying to decide like where you want to work or what type of medicine is best for you. I hope this works out for you, and I'll see you guys next time.
Don't forget to follow me at Dr. Imani Travels, all one word, on Instagram and TikTok. And if you feel like you like the vibe here and you like some really helpful tips on vet school, travel, or anything else in between, please like this video and subscribe to my channel. Thanks.